All right, look, the powers that be, and I am surrounded by powers that be, they told me we were talking about male menopause today. And to that I say, impossible. Get out of my life. What are you doing, for crying out loud? I'm in a bad mood. Don't start with me.
No. Are you menopausing?
Well, that's what they say it's all about for men and women. Let's talk about menopause in a man's life. A lot of folks say, now, that's a myth.
Oh, it is definitely not a myth. So when you think about men, what happens when they get into their 40s and 50s? First off, they go buy a Harley Davidson and they trade us in for two younger girls. However, that's a sign that they're going through menopause. Kidding. But no, what men can suffer.
They're going through years of poverty immediately after that.
Well, men kind of start to shift just like women. When our hormones drop, we get the whole syndrome of menopause. But men do too. It can be a little more subtle. They get irritable. They lose that kind of killer instinct. They start to get memory issues. They don't tolerate and cope with things well anymore. But they can also start to get hot flashes. They might notice the man boobs, so what we call gynecomastia. Their testicles might start to shrink, which some guys actually like that because it makes things look bigger in proportion, but that's...
Aren't you glad you tuned in, folks? You know, these are the shows you write home about, huh? Man boobs and hanging.
Yep. So those are some symptoms, but then also their libido starts to drop.
What are the symptoms the same with comparing men and women at menopausal years?
Not exactly, because women are more prone to the hot flashes, where only occasionally men can get hot flashes. We lose our inability to sleep well through the night. Men typically don't show that, but it's the libido, and by the time they're finally having an erectile dysfunction, they're severely low on hormones. So for them, the second they come into my office with ED, they are already in the tank with testosterone. The goal is to catch it when it's more insidious. It's the weight gain, that midsection weight gain, the beer belly in the guy that doesn't drink that much. They get, again, the irritability, that lack of killer instinct. They just don't feel well. They lose muscle mass. Their endurance drops. So they get a whole host of things that we call menopause.
See, Dr. Angela DeRosa knows these things, and she shares them with us. That's one of the reasons why we have her come in to talk about somewhat sensitive subjects like the ones we've been talking about. But when you are talking about men versus women, one of the biggest differences, I am told, is that men notoriously are hesitant to go to the doctor for anything, much less coming in and acknowledging some of the things that you were talking about.
Absolutely. And as I've joked with you before, the only way to get a man into a doctor's office is via ambulance or with erectile dysfunction. So that is the only, otherwise their wives are dragging them, kicking and screaming. So they're notoriously bad at coming to visit the doctor. But it's really important because that age time frame, although they might start to feel bad, but they don't want to address it because first then they got to admit something might be wrong. And there's also a lot of fear that goes with that because what if they find something wrong with me? And men don't like to show weakness, so that's a huge problem. But not only do we want to make sure we deal with those symptoms, but we want to be making sure there's no cancer risk, so it's a great time to get preventative screenings, colonoscopies, doing your prostate exams and all those things, because if you find those things early, they're curable.
Is hormone therapy, though, the answer for both men and women?
In my opinion, I think hormone therapy can reestablish a normal, optimal hormone level, can be excellent for the body's physiology.
For both?
For both men and women. We replace testosterone in men all the time. The other thing that we don't think about in men is men can actually get what's called estrogen excess. So when they start to gain fat in the midsection because their testosterone drops, which helps them burn sugar, they can now take whatever little testosterone they have, and in that fat tissue, there's an enzyme that converts it to estrogen. So those guys, when they have increased estrogen, their prostate cancer risk goes up. But more importantly, from a symptomatic standpoint, they start to act like PMSing girls. They get weepy, they cry at Hallmark commercials, they get the man boobs, they even get hot flash.
I'm weeping right now just as we speak about the symptoms. When I get to be 40, at least I have the information.
Yeah, so you can come see me when you can hit 40.
But how do you apply hormone therapy? Is it pills, shots, what?
Depending on the preference of the patient, we have multiple options. The most common are injections, where men can come in and we give them a shot right in the tuchus once a week or once every other week. Pellets, which we specialize in, they look like Tic Tacs. Those get inserted underneath the skin in the
You're
buttock.
putting gravel in my body? What is that?
But they're pure 100% testosterone pellets that are compressed down. Again, they look like Tic Tacs. We insert them under the skin in the buttock region with a simple, quick procedure, and they do a slow release over 4 or 5 months. Then you have the gels and creams, but those tend not to work as well. They tend to be having more side effects. But also, when you're rubbing something on your skin, you can transport that to, say, your wife or pets. I've actually had actually, believe it or not, I had a female dog a patient who had a female dog that was licking the man's skin and developed testicles because this female dog was getting testosterone from the patient.
Angela, you have maybe the most bizarre practice in the entire world of medicine.
It's definitely not boring.
We have dogs developing testicles as a result of being affectionate with the master.
Exactly. So you got to be careful if women are sleeping on their men and like tucked away in a nook or something. It rubs off on women and children's and pets. So I'm not a big fan of those because of the transportation problem that can occur to staff.
You know, if you're not a fan of those, you're even less a fan of the clock that we have, because we try to jam all of this into very short periods of time. I've got 1 minute.
Okay.
Give me a couple of myths about menopause.
Menopause, biggest myth is if you have testosterone deficiency, giving you testosterone is not going to cause prostate cancer. Actually, testosterone deficiency increases your risk for prostate cancer. So it's not, that myth is a big fallacy. The other thing is all men are going to lose some testosterone as they get older. We can't stop Mother Nature. So every single one of you is going to be affected by this.
And I'm
what
gaining
degree.
estrogen.
And you're gaining estrogen. So that's why you become more sensitive as you get older and you can relate to us better.
I find that I'm getting shorter the more estrogen I have. What else? One more myth.
One more myth is that testosterone is not going to create big, huge muscular men. This is not an anabolic steroid, which most men think, oh, am I going to be able to drug test to do other things? This is a natural hormone your body makes. We are not pumping you full of steroids, which are anabolics.
I don't know whether you know this or not. In your world of study that has been as extensive as it has been in the world of medicine, the only group of people who never ever suffer menopause, Italian chefs. And I've got one coming up, as a matter of fact, in just a moment, because we cover the entire issue. Massimo does not own a dog. This is Pat McMahon.